8,696 coronavirus cases in Victoria. That's 532 new. There are 245 Victorians in hospital, and 44 of those are receiving intensive care. We have a total number of tests at 107,588, 17,588 tests. Results processed yesterday. Obviously, the day before was a very, very significant number in the mid to high 40,000s. I'm very sad to have to inform you that there are 6 further Victorians who have passed away as a result of this infectious virus, this global pandemic. A female in her 90s, a female in her 80s, a man in his 80s, a female in her 70s, a male in his 70s, and a male in his 50s. 5 of those 6 deaths are connected to outbreaks in aged care. Beyond that, there are 4,542 total active cases, 683 active cases connected in some way to aged care, and around 400 health workers who are active cases as of the situation report first thing this morning. The key message today for every single Victorian, regardless of where they work and regardless of where they live, you simply can't go to work if you have symptoms. You can't go to work if you feel sick even mildly. You've got to come forward and get tested. We're very grateful to all of those Victorians who are doing that, but we continue to see, particularly in aged care, and Brett can speak to this in just a moment, we continue to see far too many people in that setting and in other settings. It doesn't matter what you do for a job, it doesn't matter what industry, what sector you work in. If you are going to work with symptoms, if you're going to work when you're sick, then you will inevitably be spreading this virus. This is the biggest driver. It's not the only issue, but it is the biggest driver of transmission. It is the biggest driver of these numbers going up rather than going down. So my message, my request, my plea to all Victorians, particularly those in Melbourne and Mitchell Shire, but this does apply to every single Victorian regardless of their workplace. If you are sick, even mildly, you just can't go to work. The only thing you can do is get tested. The only thing you can do is then wait at home, not going to the shops, not going anywhere until you get your test results. And if you're negative, well, then you can go about your business. If you are positive, then you will need to be at home for that 14-day period. I know that's inconvenient, but I wouldn't want anyone to have a sense of awkwardness or embarrassment. I've had some feedback that some people are very reticent to necessarily discuss symptoms or a positive diagnosis with family members. They might see that as somehow being a reflection on their family or a reflection on them. This does not discriminate. This does not discriminate. No one will be criticised or judged for doing the right thing. That's exactly what we want to see happen. If you've got a sniffle, a scratchy throat, a headache, fever, then you can't go to work. The only place you can go to is one of the more than 160 test sites across Victoria. Get tested, have those couple of days away from other people at home, and then depending on the results of that test, you can either go back to normal, and we'll be deeply grateful to you, far from thinking less of you. This does not discriminate. It doesn't matter where you're from, where your parents are from, where you live, where you work, your bank balance. It does not discriminate. It is wildly infectious. And at the moment, we've just got, without it being a matter of judgment, it's just a matter of fact, we have too many people who have symptoms and they are going to work. And what that means, even with mask wearing, even with hand hygiene, even with distancing, that is an unacceptable risk in terms of transmitting this virus. That is what is driving these numbers up, and the lockdown will not end until people stop going to work with symptoms and instead go and get tested because they have symptoms. It's not a matter of blame, it's not a matter of judgment. These are the facts, and unless we see a change, then we're going to continue to see these numbers at an unacceptably high level. So please, do something that we will all be so grateful for. Act on your symptoms. Don't ignore them. Don't head to work. Instead, head to get tested. And we will get you your result as fast as we possibly can, and we will then be able to make decisions based on the risk that you pose to those you love, to those you've never met, to those you work with, to every single Victorian. This is the message of the day, and it's going to continue to be the message each and every day until we start to see the number of people who are presenting for work as if they didn't have symptoms, when in fact they do. Presenting for work when they're a close contact of someone who has symptoms, pretending that they aren't. That's just not acceptable. We have support in place, a $300 payment and then a further $1,500 payment if you are positive and need to isolate for that 2-week period and you're in insecure work. We know that's driving some of this, but regardless of what is driving this, because we do have dedicated and I think effective policies in place, and we'll be able a bit later in the week to provide you with an update in terms of the uptake of those options. But as it stands right now, we are seeing too many people, for whatever reason, attending work with symptoms. That just cannot continue. Otherwise, these restrictions will be in place for longer than they should be. And I'm sorry to say, we will see more people die, particularly in aged care. And Brett can speak directly to this. The ultimate consequence, if people are going to work sick, is that people will become infected and therefore people will die. Get tested and get tested quickly, and then stay at home until you get your result. That's the key message, and it's going to keep being the key message until we start to see those numbers come down.